Welcome to Europe Explained, brought to you by the Council of Europe. This podcast series offers a unique window into what we're doing to create a fairer, more democratic Europe. Through conversations with experts and frontline workers, we bring you closer to the issues that matter, from fighting discrimination to upholding human rights, from defending democracy to building laws, systems and institutions that are just, fair and open to all.
Welcome to this new episode of Europe Explained, the Council of Europe's podcast that highlights the work of the Council on human rights, democracy and the rule of law. In today's episode, we're going to talk about the work of the CPT on healthcare protection in prisons, the CPT, which is the European Committee for the Prevention of Torture, of Inhuman and Degrading Treatment of Punishment. So we've done other episodes on the committee you can go and listen to if you want to go further. To talk about this topic, I've been joined by three specialists. Hans Wolff, hello. You are a medical doctor, professor at the University of Geneva and in charge of the prison health service at university hospitals in Geneva in Switzerland.
Hello.
You've been a member of the committee for 12 years. And Kelly Sipp and Laura Ielciu, hello. You're both advisors within the Secretariat of the CPT. Hans, I'll start with you. How can you describe how important healthcare services are in prisons?
They are of crucial importance. It's because you have to understand that people in prison, they suffer socioeconomic disadvantage. And this leads, we know that people with low socioeconomic status have higher morbidity, meaning frequency of illnesses. And in particular, this refers to mental health, to substance use disorders, to infections, in particular viral infections like HIV, hepatitis C and B, and also injuries. And this also includes those injuries inflicted by state officials, for example, at arrest by the police. And when you consider this and you know that this morbidity, so the frequency of illnesses is so high, the first thing is to identify this. People in the healthcare service, if this is efficient, is able to identify it, to see people very quickly, in general in the first 24 hours, and also then take the appropriate measures, meaning treatment, and also act preventively. And this is important because prisons play a role in public health. This is generally a key population for public health. And if the prison service does correctly the work, they will, the people who go out, who will be released, will be in better shape and will not, in any case, not be a threat, a sanitary risk for the population. And this is really an important role. For example, I know people who have never seen a doctor in their life. They have never received any vaccination. And this can also be a very important role of the prison health services in prison.
And so the committee focuses on preventing torture and inhuman or degrading treatment. In this context, Laura, could the absence of adequate healthcare services in a prison be considered a form of torture or ill treatment?
Indeed, the CE is a Council of Europe treaty-based monitoring body, and its mission is to contribute to the prevention of torture and of other forms of ill treatment of people who are deprived of their liberty. And this happens in places such as police stations, prisons, and also psychiatric hospitals, social care homes, immigration detention centers. Now, the CPT mandate derives from Article 3 of the European Convention on Human Rights. And this article prohibits, in absolute terms, torture and ill treatment. And this prohibition, as I said, it's absolute, so it admits no exception or derogations. Ill treatment of people deprived of liberty can take a lot of forms. One of the most obvious is physical violence inflicted, for example, by staff in places of deprivation of liberty or by other people held there. In this situation, prison healthcare services have a key role to play in detecting, documenting and reporting such cases to the relevant investigative authorities. And this will be explained further on by Hans and Kelly. So during the visit CPT does in places of deprivation of liberty, and in particular prisons, the CPT will look into how healthcare services meet this responsibility. Even when there is no intention on the part of the authorities to cause harm, there can be situations where there are shortcomings, for example, in the detention conditions, which are so severe that they can lead for the people that are detained in prisons to a situation which indeed violates the prohibition of ill treatment.
Are you talking about overcrowding or something else?
In particular here, this can happen when prisoners do not receive the medical treatment they need, and this concerns both somatic and psychiatric treatment. And it can also happen when the medical treatment they receive is not adequate. So when the CPT visits a prison, it will also look into issues such as access to healthcare and the quality of the healthcare people detained receive in that prison.
And so Kelly, Laura was just talking about preventing ill treatment. How can these healthcare services be proactive?
Sure. Their role is actually absolutely central. And one of the priorities of the CPT is to look at the way allegations of ill treatment of prisoners are treated by the healthcare services and the various protocols that are in place when they examine injuries. For example, the delegation will ask, we'll look at whether there are medical reports following incidents, how are those injuries recorded, is there a special trauma register? And what is the communication between the prison staff and the healthcare services in case of an incident? And the report, for example, should contain three things. A full account of the objective medical findings based on the thorough examination of the doctor. And this would usually also include a body chart where the professional can actually mark the traumatic injuries or photographs. And the second thing would be an account of the statements made by the persons which are relevant to the examination. And the third thing is the healthcare professionals' observations, indicating the consistency between the allegation and the objective medical findings. Where it is appropriate, this means where the injuries are consistent with an allegation of ill treatment, or even in the absence of an allegation where the injuries are clearly indicative of ill treatment, this record should be reported to relevant investigative authorities. In this case, it's absolutely crucial that healthcare staff and prisoners concerned are protected from any reprisals. So the CPT usually is making sure staff, prison officers, are not present in the consultation room, for example, when the healthcare staff examines a person who has injuries after an incident. On the ground, we see that these records are quite vary in quality from one establishment to another, from one country to another. And we see that healthcare staff should really be trained to document, to interpret, and to report injuries. They should also be trained to interview people who have sustained injuries following incidents of violence or particularly traumatic experiences. We see, for example, and I've seen during my visits, that some prisoners have lost completely trust in the healthcare staff.
Because of a few bad experiences, or like Hans was saying, because some have never really been in contact with doctors, for example?
Yeah, exactly. But also, for example, if they are concerned by a particular incident, if the healthcare staff is not present and does not interview the prisoner or does not record the injury, they will lose trust in the staff. And so it's important for the healthcare professionals to actually make every effort possible to engage with the prisoners and ask themselves, what are the dynamics in the establishment? What's the level of violence? What is the day-to-day condition where the prisoners live in? And they need this direct contact and these regular visits on site where the prisoners live.
And what's an acceptable level of comfort? I don't know if that's the right word, but what are the CPT standards regarding to healthcare protection in prisons?
Yeah, before I explain the standards, maybe I would like to follow up on what just Kelly said about the importance of trust. Because if there is no trustful doctor-patient relationship in prison, you can almost do nothing, in particular not fulfill one of the important tasks of healthcare teams which are important to the CPT, meaning to record and report ill treatment. And I remember, for example, when I started 18 years ago working in prisons, I was at a medical conference, and the organizers invited prisoners to the conference to talk about the quality of healthcare they perceive in this prison. And there were 3 prisoners, and all 3 said at the opening statement, "We don't trust our doctors." And this was in a country where the doctors worked under the authority of the Ministry of Justice. And this refers to one of the standards already, which is the independence. And even if the doctors do their work totally correctly and will never report any confidential issues to the Ministry of Justice in this case, there is also the perceived dependence of the Ministry of Justice. And this is very important. This is one of the reasons why CPT now, since at least 10 years, insists that the optimal organization of healthcare services in prison is related to independence, meaning at the Ministry of Health or at least a sanitary authority.
So as a doctor, is that one of the first things you would tell an inmate to ensure that there's a climate of security and in the room?
Exactly. For example, in Geneva, we have everywhere on our clothing, on the doors, it's University Hospital of Geneva. And the people know this is healthcare and they know the secrecy is guaranteed. And this is not the case everywhere. There's about 10 countries now in the Council of Europe, 10, a bit more. But some countries have only partly independence. So it's really work in progress. And countries which reform their prison health organization generally go towards independence. So they bring this under the authority of Ministry of Health. But let me talk about other standards. And one of the most important is the equivalence of care. So our organization in prison should be like outside.
They have the same rights.
It should be. In any case, they have the same rights, but they also should receive the same quality of healthcare, the same medicaments, the same procedures, the same investigations. And in particular, healthcare staff must take into account their needs. I talked initially about the higher morbidity, so frequency. They have much more illness, about 10 times more compared to of almost every illness. It's higher, it's more frequent in prison. And healthcare professionals need to take this into account and use a equity-based approach, meaning higher morbidity must say higher intensity of healthcare in a way. And it should not be equality principle. It shouldn't be exactly the same. It should even be more because they have a higher need, so needs-based approach.
And sorry, just for that, is it easy to adapt to every person in the prison, or is it hard to make it do you have very general rules, or can you adapt to each patient?
It must be adopted. So it must be individualized, as every person who goes to the doctor wants to be taken as a single patient, and the doctor is my treating doctor. Talk about the loyalty of doctors towards the patients. Let's say other important issues when it comes to standards is the access. So healthcare services need to be accessible all times for emergencies and also rapidly if there is a need for the prisoners. This access must be confidential, and also the consultation must be confidential, meaning there is no state official inside the room. There is no camera, no microphones. There must be security systems, that's clear, if something happens. But generally we recommend that, for example, if there is a doubt about security, there could be 2 healthcare professionals who make the consultation, and only in very exceptional cases, but this should be maybe 1 out of 1,000, not more, we could accept that for security reasons, a staff is inside the consultation room and breaches the confidentiality because the security requests this, and it's only allowed if the doctor requests it. It should never be imposed by the security system. Other issues of importance are the competence. We would never accept that people, so doctors, nurses, psychiatrists, psychologists, who are not allowed to work in the outside community would be allowed inside. I know a country, a big country, it's not in the Council of Europe, who allows this, that doctors who are not allowed anymore to work for patients outside are finally allowed in the prison.
And why? Because they don't have enough staff? Or is
This is a big problem because they lack staff, and then they accept somehow a lower quality of healthcare if people who are not fit to work outside are allowed inside. So this is one of our standards. We would not allow it. They need to have the same qualifications.
And what about the use of substances? There's a lot of speculation around that topic in the general public, but I believe that, Hans, you've worked on that quite a bit. Is that also a big issue?
It's a big issue for different reasons. There are actually two reasons. One reason is that substance use can be a criminal offense and therefore concentrates people with substance use inside prison. We know, for example, that Richard Nixon in the 70s declared the war on drugs, and this increased dramatically the number of substance users in prison. And the second is that people who have infectious disease are linked to substance use, so increase other illnesses like, for example, hepatitis C and HIV in prison. So this is one of the linked issues to substance use disorders. It is important to, again, apply the principle of equivalence. They should receive the same treatment. In particular, the medication for opioid use disorder must be also available, and not only for patients who have the treatment outside when they come in, but also to start. And this is an important issue because there are a lot of people which are not connected to healthcare outside in the community come to prison finally, and they use illegally on the black market opioids or drugs. And then the doctor should be able to initiate such a treatment in prison if it's well done. Further linked to substance use disorder, there are risks the people take. And this refers again to the trust. If the doctor, for example, I had a patient, I had a very good relationship with him, and he told me how he receives his cocaine illegally in the prison. He said the cocaine smells not very good, and you can imagine how this cocaine did come to prison. And then he explained me which risk he takes when he uses the cocaine by sniffing or by injecting. And it's important that the doctors have this trustful patient-doctor relationship to get this information and then apply the appropriate measures. For example, harm reduction measures, like needle exchange programs, which are, it's a shame, very little prison have this. About 60 prisons in the world have this. And it's one of the most effective harm reduction measures we know. There is also, for sexual risk, condom distribution should be done in prison. There must be counseling, there must be screening, and all this together is a package which applies again to the standards and to quality of healthcare.
And talking about counselling, Kelly, what's the place of mental health? How important is it in these healthcare services?
Sure. It's gained more and more attention over the years. Mental health in prison has become really a major point of attention for the committee as well. And as Hans was explaining, prisoners tend to experience a significantly higher prevalence of mental health-related problems compared to the general population, often linked to a history of trauma, sometimes including sexual abuse or other forms of gender-based violence, and substance use disorders. And arriving in a place of detention can be particularly traumatic. And this period involves an increased risk of self-harm and suicide. And then while in detention, you have social isolation, solitary confinement, long sentences, period immediately before or after trials, and even the period before the release needs particular attention because it involves also increased risks of self-harm and suicide, in addition to worsening mental health issues. So here again, healthcare services have a key role to play in addressing each situation with sensitivity as early as possible so people can get the tailored support that they need. Psychiatrists and clinical psychologists and mental health nurses need to be on a daily communication with the other healthcare professionals. And often this is not the case from what we see during our visits. And I mentioned solitary confinement because this is really an important area that we always look at when we visit prisons, because it can have an extremely damaging effect on persons. The CPT says that it should be only imposed in exceptional cases and as a measure of last resort and for the shortest possible period of time. And I can maybe talk about an example of a case of a person that I've met. In one of my visits, a person who was isolated because the person was living with HIV, and they were placed in medical isolation despite the prison doctor's opinion against it. And the CPT has been quite strong also about this point for a very long time, that there's no medical justification for separating prisoners solely on the basis of having HIV. And in this particular case, the person was living in very poor conditions with bed bugs. The mattresses and the blankets had not been changed for 3 months. They had no access to an outdoor area for 3 months. So you can imagine the impact that this had on the person's mental health. Thankfully, in some way, this is where we see our positive impact sometimes when we visit these establishments, is that we were able to help change this person's situation. And this person, after our visit, was actually transferred to a better environment where they had access to an outdoor area and a safe area.
I think it's very important what you say, and this refers also to a trend we see in the last 20 years in Europe, the increase of mental health problems in prison. And the prisons in almost every country have huge and increasing difficulties to address these people to professional treatment, in particular to hospitals. So what we see, and this is one of our last visits, we saw units where these people are somehow parked and without treatment, without seeing healthcare professionals, with prison staff, very committed prison staff, but they just don't have the tools and the training to address these very difficult patients. And at the end, this leads to a suffering and to really undignified conditions, and certainly also violations of Article 3. This is really a problem which also refers to the lack of healthcare staff, in particular to psychiatrists and psychologists. And this is an increasing problem, and we try to have discussions with the countries generally to find solutions to it.
Yeah, if I may just add to this point, also self-harm and agitation, for example, or decompensation is often dealt with in a punitive approach. And because the custodial staff don't have the tools, they're not necessarily trained to de-escalate situations of tension. So the only tool that they have is a disciplinary sanction. Yeah. And so this is obviously not the way to go about. And these people who have severe mental health disorders like acute psychosis or major depression need to be immediately referred to a civil psychiatric hospital or an adequate therapeutic environment within the prison system.
It's always a difficult balance, I imagine, between security and health. And so regarding to what Kelly just said, Laura, in an ideal world, let's hope it's not too far away, what would a smooth operation of healthcare in prison look like? You've mentioned a few examples, but what would it look like?
It refers to the standards. If I start, I think it's clear that the standard access to care must be guaranteed. Initial screening must be guaranteed. Equivalence to training of the professionals, competence of the professionals, independence. And these standards are really important pillars to guarantee that there is equality. And not only quality, but also an environment in which the people are respected. And the respect is clearly to the patient, but it's also a respect of the roles. And if we maybe touch on the important role of prison health in prison, it is not very natural that a doctor communicates, for example, with the prison management. And we see frequently countries where the doctor just pops in regularly, let's say 2-3 times a week, just does the consultations and then leaves. And this is not a system which is very good. We want a a really professional prison health service with generally a doctor or nurse who have communications, regular, weekly or daily communications. And also the skills, for example, to develop epidemic control, epidemiologic oversight. That's also important to describe, to know what are the illnesses in prison, how frequent are they, and then also communicate with public health. If this is all guaranteed, that's important. And I think then the quality can be really good. If I break it down to one thing, I think it's a lot which goes on trust. And if you have prisoners who don't trust the doctor for different reasons, and it can start just by the organization, as I told before, related to independence or lack or perceived conflict of interest, then you cannot do a good work. If I just cite maybe one example, this is Spain. Spain had a huge HIV crisis all over the world, but particularly in Spain. And there was a real excellent acknowledgement that prisoners are a key population for this, because the people went in, out prison, because drug use was punished and the people came into prison. And what they did is all the partners, the NGOs, the public authorities and the prisons work together. They have the same patient and the same professionals who see the patients before, during and after imprisonment. And they managed to decrease dramatically the prevalence of HIV in prison. They also managed to decrease the numbers who were sentenced to prison, so they managed also to keep them better outside. But it was more this coordinated approach, which is linking different services, in particular prison services and public health, which was successful.
And Laura, do you have other successful examples, apart from Spain, examples that show the changes made thanks to your work with the CPT?
Yes, of course, there are such examples. I would also like to refer a little bit more broadly to the work the Council of Europe is doing in this area, especially through technical cooperation with the member states. The CPT is a fact-finding body, so it goes in prisons, and its task is to identify those areas where the authorities need to make improvements in order to prevent ill treatment. And the CPT also recommends measures that the authorities need to take to bring about these improvements. And we see in our work, and I think Kelly and Hans have explained this very well, we see that sometimes this kind of improvement requires systemic and complex changes in the countries concerned. And for this situation, the Council of Europe has specialist departments that deal with technical cooperation. And these departments can develop programs and provide support to the member states, to the countries concerned, to make these systemic and complex changes they need to do. And when these programs are developed, the CPT's recommendation to the country concerned are obviously taken into account. And the cooperation activities aim at implementing those standards. The CPT's general standards are taken into account, the ones on healthcare in prison, for example, and also the other requirements the Council of Europe has in the area concerned. The best known would be the requirements that come from the judgments of the European Court of Human Rights. And as we speak, there are several operations activities ongoing in several member states. Hans was mentioning the importance of healthcare staff being independent, but also being perceived as independent. And he mentioned that for this reason, the CPT recommends that healthcare services in prison be under the supervision of the Ministry of Health. And this is an example of complex and major change in the system. And there have been situations where the cooperation services in the Council of Europe have helped states to achieve this. Another example is in Armenia. Now there is a cooperation project ongoing with the objective to allow prisoners to have also access to medical services in the community, and this will be done through telemedicine. So the project focuses on developing telemedicine within the prison system. Another issue Hans and Kelly have mentioned is the lack of staff in prison healthcare services. And in this context, another cooperation activity in another country, in Romania, is now ongoing. The relevant unit of the Council of Europe, which is the Division for Cooperation in Police and Deprivation of Liberty, have helped the Romanian authorities to come up with a plan of concrete measures to attract healthcare staff to work in the prison system. And many cooperation projects, they have also a training component. So, for example, they would organize activities, training activities for prison healthcare staff on various topics. For example, medical ethics, which is specific to the prison system, health screening of prisoners upon admission, or another topic that was mentioned, documenting and recording injuries.
So a lot of positive aspects of your work. Well, thank you for coming and sharing all this with us. Thank you.
Thank you.
If you enjoyed this discussion and wish to explore more topics, be sure to check out the episodes of Europe Explained. You can learn more about the Council of Europe and its initiatives at our website, coe.int. And don't forget to follow us on social media for the latest updates and insights. You can find us on X, LinkedIn, Facebook, and Instagram.